experience with you. As impossible to avoid to treat this or to address this topic, which is the current more important health situation in the world, and it is so in our country. And fortunately, it looks like things are becoming better and better. And I wish that we could all contribute in a better manner for the overcome of this pandemic. Well, let me share with you some of the information. Well, of course, that here I'm not giving you any different from what has been published, but anyway, just to have a little recall on what we are facing, and in certain way, giving us the basis for developing our treatment strategies, and according to the different kind of presentation of this disease, is that in Chinese medicine we could not only follow the experience from the modern research and all the specific strategies to deal with certain infections or viruses or symptoms, but starting from these information, we could start creating the diagnosis in Chinese medicine. So more information just to address one of the points that have been the main issue recently, not only the type of stage that we are facing, and for that of course we need to give a different approach. If it is acute stage, if it is a mild case, if it is a moderate, severe cases, if we want to prevent it from occurring, or if we are facing now what we call the persistent COVID or long COVID. So anyway, in Chinese medicine, we have information that stresses that we could use either acupuncture or herbal medicine in order to increase the immune system, to protect the body from developing any disease. And of course, for different categories of disease, we could always implement a different approach, create a great sort of diagnosis and develop a therapeutic principle. And though diseases are some kind categorized or classified in different ways, and it is so with the infectious diseases or the external diseases, the viral diseases, and now according to Chinese medicine, COVID belongs to what we call the infectious diseases or febrile diseases. So according to these criteria, then in Chinese medicine, either acupuncture or herbal medicine, we are able to tailor a kind of a formula, either of acupuncture points, which all have certain functions and indications, and we create tailor a specific formula for any specific condition, any specific disease. And it is so for febrile or heat diseases, or diseases that have certain effect in certain areas, certain organs, or that the way they create the pathological process, how they affect different organs, how they affect different channels, and how they evolve, how they are able to control in the different stages. I think that is a very important thing, not only to kind of set a recipe, a fixed recipe, that this recipe, it is for the treatment of colitis or colitis, this is for headache, this is for what. We have to always make a very clear overall syndromatic or very well holistic diagnosis to understand not only what is causing disease in that particular moment, and what is the pathological process that has been gradually damaging or gradually affecting different organs and systems. So we have to know that path, how it goes, how it develops, how it comes from the external aspect and goes deeper into the body, creating more and more and more affections to different functions in the body. So that's, we have to know, we have to study the patient in every aspect, in every moment where he is dealing or fighting against disease. So here it's just a very simple way to put how in Chinese medicine they accept how different types of diseases that comes from the external, diseases that develop from the interior, related a lot with emotions and the miscellaneous, which has to do a lot with food, with nutrition, and how specifically for the external pathogenic factors, how the body interacts with all of them and how it defends its body from occurring the pathological process. But a very severe one, which is the diseases caused by heat or the febrile diseases, they are more aggressive, more destructive. They tend to penetrate faster and deeper, creating more and more damage. So many viruses or many diseases that come from bacteria from the exterior have this kind of behavior. And then that's the way that Chinese medicine has been studying viruses, and coronavirus and this pandemic has been addressed from this pathological process called the Wenpingxie, or diseases that acquire from heat or that causes this damage. And that the particular way they penetrate into the body is in different stages. There's from the exterior, the Wei Qi level, then goes to the Qi level, to the Yin level, to the Xue level. It's just the more outer aspect is the surface of the body, then it goes deeper and deeper and deeper. And as it goes deeper into the body, it creates more and more damage. And then the treatment strategy has to differ, has to be more aggressive at the same time. They have to do different types of formulas. It's herbal medicine, or of course with acupuncture, have to be more aggressive. The treatment has to be more frequently, and the techniques has to be more aggressive in various ways, as you will see. But then coming back to how we develop, how we are exposed to these diseases, it's the way we are able to defend ourselves the best. So, and we have to understand then what is the position and what are the risks that we have, or the condition that we have to be in order to get diseases. So these are some of the pathological, etiological factors that will probably put a person in a risk to develop this kind of disease, to be weaker, to acquire the diseases from the pathogenic factors from the exterior. So here, if we have a weak antipathogenic energy, the Cheng Qi, then the external or the invasive epidemic factor could penetrate the body and cause disease. Well, now we know that this Cheng Qi, or this defensive mechanism of the body, definitely is related to the immune system, and in ways of comparing the way it's been referred, the function of the different organs in Chinese medicine, kidney, lung, and spleen. We all know that according to TCM, the way these organs are creating their physiological process, they could be the representative in Chinese medicine of the immune system in various ways. And then the affection of these systems will be reflected in different aspects of immune system that has been assessed through modern research. So then again, coming back to this table of the penetration of the fever factor, the febrile disease, heat that creates more damage. And then one of the things that causes at the beginning is just impairs the function of the lungs. It probably causes minor symptoms, and as if it goes deeper, it will create more and more damage, and then the symptoms will be more clear, more difficult to recover. And then here is one of the important processes that I'm always stressing: the formation of phlegm and the creation of heat, which will in fact, will do more damage to the organs, to the tissues, and will create fibrosis, will create inflammatory processes more and more severe. And then it is the case on the coronavirus's different stages that we have more and more symptoms, more aggressive to the body. The damage will create more problems and will be difficult to treat or to recover, and will be more prone to develop all kinds of sequela. So here is just a table that I took from a book, and just to create what is the behavior or the different stages that have been identified for different viral diseases. And this is for influenza or influenza-like disorders where coronavirus also fits in. And here is how there is different stages: the prevention, the early stage, the late stage, and the recovery stage. So I'm just giving you the sense that there is being there, of course, from the Chinese books to give us this kind of information that what we need to do in order to treat these kind of conditions in different stages. So as you see, at the beginning, it starts from the exterior with wind cold syndromes. Then it goes like a combination of cold and heat, then creates dampness, and then it creates a little bit more of toxin, or the toxin stagnation, more damage to the body. The qi is damaged, the yin is damaged, then it creates deficiencies in different organs, and then we need to face that the recovery state. We have to strengthen the organs that were damaged on the previous stages. So here is another way to categorize it. Also, now it's been also accepted, this kind of category or the different stages of the disease for coronavirus, for COVID-19. So we have the phase 0, phase 1, 2, 3, and the rehabilitation. And then and it falls in different category probably. And it doesn't matter whether if the patient was at the beginning of the phase 1 or 2 or 3, it will probably develop certain amount of post-COVID or long COVID symptoms that we are more and more able to recognize in our clinic recently. Now, and everything is an excuse. Now, the patient that's come to the clinic and they always ask, could this be related to COVID? Because I had COVID 1 month ago, last year, or 4 months ago. And many times in various clinics, the people are telling them that those kind of sequelae, those kind of changes in their health condition, it is related to the COVID infection. And not only that, but now we know, and I'm not going to address this topic today, but also the post-vaccine condition has been very, very frequently observed in our daily practice. So here is a analysis of the different stages and what could we give as for acupuncture or herbal medicine to put our patients in a better condition. Of course, in the phase 0, we never give any other kind of medication. We kind of do a preventive treatment to strengthen the immune system, to strengthen the lung, the spleen, the kidney, and to protect the lungs. So people who give this kind of a preventive treatment, that this is very, very possible. And not only that, the people come specifically to say, hey, doctor, could you please give me a treatment to prevent COVID? And of course, I cannot guarantee that, and I cannot advertise this kind of thing. But it comes, the people come to the clinic for different conditions, and at the same time, you start doing something specific to strengthen the immune system, to strengthen the lungs, and specifically those who have a previous history of weakness or different kinds of external diseases, probably, or of course, like those who are more vulnerable because they have chronic diseases, they also need to have a sort of a preventive treatment in this era, in this COVID-19 era. But not only that, people who come regularly to acupuncture for any condition, if you always do what I said, an overall, an integral treatment, where you do not only go and treat the particular disease or the particular symptom that the patient comes for at the clinic, but you always do a very comprehensive treatment, then those people will be protected, even if you do or not any specific thing. People who come to acupuncture regularly, you could tell that their immune system is stronger than the people that do not acupuncture. Of course, there are other ways, and of course, they have to take care of their daily exercise and a good diet and everything that we all know. But acupuncture as a preventive strategy, it is always very good. So well, here is just a sample of points. The T means tonification, D dispersion, M moxibustion, and B bleeding, which I will need to do in certain cases. This is not like, as I said, as a fixed formula, but as you see, if you compare the objective or the therapeutic principle with the selection of points below, they have to match. Sometimes you could add more, or you could not give all those points. And especially, I always recommend not necessarily. Most of the times, I do not do bilateral point selection, and that is an explanation for. I'm not going to stop there now, but well, for phase one of the COVID-19 and the mild cases, then people come with symptoms, sore throat, fever, cough, usually like a common cold many times. But now every patient that comes with such a symptom, or either you have to suspect that they might have COVID, or they already know it because they did a test, or they are afraid that they might have it. Many times they even call before coming if they are able to be treated, if they are able, because they probably have COVID. So that is an issue. Sometimes they just don't go out and they stay at home. And for those cases, for many of those cases, if there are my patients previously of there were recommended to be for somebody else, I will probably be sending a formula, a herbal formula, to at least do something in the meantime while they know if they are positive or not, and they finally decide to come to visit at the clinic. So here is another selection of points, which then, according to the symptomatology, then you expect that there is more symptoms and there are more issues on the flow of qi, and then it is started to affect the lung qi, and then you have to continue to strengthen the spleen and the kidney. You started reducing the fever, start stopping the cough, start preventing more development of phlegm. So here we have some of the points that you could always add in case of some of the symptoms that commonly come with. It will probably do better if you add certain points. You have to always adjust according to what is going on that particular moment that the patient comes to you to visit. Then in the phase two, even I have to tell you that in the phase one, many times also I can give a kind of a standard formula of herbal medicine that also covers a kind of a wide range of scope for symptoms. Usually these are very mild, and they, or even sometimes they just become positive even though they have very mild or non-symptoms, but they already have a test that it is positive. So then I could give the herbal formula and send the formula to their houses. For phase two, usually what I need in order not only to give acupuncture treatment or to design a formula for them for herbal medicine, I need to see at least the picture of a tongue, a good picture of the tongue, so then give me more idea what is going on. And then many times these patients will not come if they know already that they are positive and if they are facing a moderate condition, and they will probably not dare to come. But many do. I have in my clinic, I didn't stop all this pandemic. I've been treating patients all the time. So I have patients coming on this phase two. And actually, I'm the one who suggested that they might probably have it. And even I have tests in my clinic. So I test them and I know that they were positive. And then I did extra things, and I did extra procedures with acupuncture and prescribe a complementary herbal formula. So here, you still continue to strengthen the adiabatic energy. You have to release the external heat, which is more evident, of course. Then the dampness or the formation of phlegm has also become to build up. So we also need to address that part. So here are some of the points that you
5
can ask.
minutes.
Yeah, good. Oh, I know, I think I had 40 minutes, Thomas. It was 40 minutes for my talk.
As far as I know, no.
Yeah, check. So then I think I have a little more time, I think. Please check. So then, and in phase 3, again, there's always a possibility to be able to be in contact with these patients in different facilities. Probably you find them at your clinic, or you will probably need to do something at home, which I did also. And then a more aggressive treatment needs to be done. As you see here, I added the bleeding of points like Keshu and Tatri, because then the phlegm and blood stagnation had been developing, more aggressive in points like Fonlong and Trungwan, which are very important to transform phlegm, to eliminate phlegm. And according to different symptoms, like here I have it, they have a nausea or diarrhea, or if they have more tightness in the chest or shortness of breath, then we need to add certain points. And definitely this kind of approach, this kind of formula could be adapted to the particular time and the particular patient. But usually we could classify the different stages according to these principles. And then if we have the chance to have these patients in our clinic or visit them at home, then there is a way that we need to approach them.
Sorry,
Definitely,
Francisco, you were right. Sorry, you were right. Sorry.
All right, I will continue. I will not run then. Okay, then here there's apart from the while where the patient have passed through it probably never, they don't have to go from phase 1 and then have the recovery, and they are in the rehabilitation phase, which still according to what had happened, then you need to do more of what it's recommended here. So you continue to regenerate the fluids, to nourish the yin, because usually after a febrile or heat disease has invaded the body, usually it always have or either some residual heat remaining that you have to check on that, or still there is some damage to certain organ functions, to the qi, but generally they damaged a little bit the fluids, could damage the yin, and according to how damaged they were, then you need to do more things, not only with acupuncture but with herbal medicine. You will still continue to build up the energy of the lung specifically, continue protecting the kidney and the spleen, and if there were some blood stagnation, you still need to do so. Any patient who have had heat and body fluid damage and yin deficiency, there are more, and especially with kidney qi or spleen qi deficiency, they're more prone to develop certain amount of blood stagnation, that it is very wise to always try to do so. So here is now the so far called the post-COVID syndrome, the long COVID, which we are more and more seeing patients in this stage. The good thing is that now we don't have, I don't have more, very few cases now, almost none, I should say, lately, of the different stages of the acute phase. But now I'm getting a lot of post-COVID, or in the rehabilitation stage, or in a mild post-COVID syndrome, or some of them even in a little more severe long COVID, which has a lot of things. As you see, these all are accepted as the frequent symptoms associated with long COVID, but anything can fall into this. These probably are the reported ones, and I shall share with you that definitely most of what is listed here, I've been looking at the clinic, and then you have to tailor the treatment according to what is going on, what part was mainly affected, and you should also follow the same thing as I said, is what it is associated fluid damage, yin deficiency, potential residual heat, the qi damage and consumption of the spleen and lung mainly, and then of course the potential remaining of flame and blood stagnation. So then here's the therapeutic principle for this: cool residual heat, nourish, regenerate fluids and yin, tonify the lungs, spleen and kidney qi, transform phlegm, break blood, stagnation, or invigorate blood. You continue using the formula for the rehabilitation, which somehow that was the main objective of rehabilitation, trying to get rid of all the remaining things of the potential development of this sequela. So then you could add other things like here. If there was a predominance of deficiency of spleen and lung qi, then you could have these kind of symptoms and add this kind of points. Sometimes those points were already included in the previous formula, but you stress a little bit more on certain points. You still continue to get rid of the flame and strengthening the lung specifically, but still you have to do a little more on blood and phlegm or blood stagnation. Again, when there is qi and yin deficiency, I think this is a very common pattern that includes a lot of chronic diseases, and we could say that this is a chronic stage of the COVID. So then we have to face our treatment, to focus our treatment on this particular thing, qi and yin deficiency, and avoid further phlegm and blood stagnation development. Again, when there is stagnation in the channel, then you do a little more aggressive things. You probably not only be aggressive on the treatment of blood stagnation and phlegm, but also you will doing things like bleeding certain points, points like I mentioned before, the Keshu and Xuehai, and any other point that continues to promote the clearing of phlegm and heat and blood stagnation. So during my talk, I've been all the time addressing that herbal medicine. I know that the acupuncture is very powerful, and I do mainly acupuncture, but the combination of acupuncture with herbal medicine is very important. It had become a very important part of my practice over the years, and I respect more and more the use of both systems. I think you can do a more comprehensive treatment, specifically to certain diseases. So here it is a belief that acupuncture in general is used to do treatment for more superficial, for milder conditions, for the initial stages of disease. Now I know that we can do acupuncture for very severe cases as well, and obtain marvelous, incredible, sometimes suppressive outcomes. But definitely the combination of acupuncture and herbal medicine will be more effective. Here it's just to continue to strengthen the idea of why, for the particular COVID or for these febrile or heat diseases, how in China they've been using herbal medicine a lot, and these are some of the evidence of certain formulas which do treat COVID as a heat disease, and have developed some experimental research has proven the effectiveness. How it is, what happens through the use of these formulas. Here is more evidence what have happened to the use of Chinese herbal medicine. And now, what we do in Mexico for over the years, we have take the best of Chinese medicine and herbal medicine, and of course to get the herbs directly, and the amount of herbs that you might need to give the cautions to all your patients will be impossible, will be unpayable, and will probably be where we have a lot of problems in importing and getting the products from China or from the United States. But then we develop a system of tinctures, and we can get any product, not only from China, but also some herbs in Mexico. that will do the job of that particular, or are the same herbs in China, or similar, and we could use them instead to develop our own formulas to treat all kinds of conditions. Like I have designed a general basic formula for strengthening the immune system and protecting the lung, that it is given to all the people that I know, all the patients that come regularly. And so far it looks like, and also my students and my friends have been using this kind of formula, and the rate of infection could be, I don't have any statistical research performed on this, but it's clearly shown in the other statistics of the occurrence of disease. So I am sure that I'm doing a good job on preventive, and that is why acupuncture is very important to prevent not only COVID, but to strengthen the immune system to fight against all kinds of diseases. So again, just how I was explaining now that to combine both systems is much better, and also not only to prevent, but also to in any case you could probably stop the disease from progression, and to prevent to a certain extent the sequela, and of course the occurrence of long COVID. I could say that, and actually I have the confidence now that all the patients have come with all kinds of post-COVID conditions, different kinds of symptoms, definitely through acupuncture till now, even though I have some cases that I'm still working on them, the very clear response has been shown. All patients has complaints of post-COVID from the first treatment of acupuncture, mainly acupuncture, but of course I combine with herbal medicine if needed. They experience a recovery. They get much better, much faster. If whatever of the symptoms that were listed or the conditions that were listed in that post-COVID list, they get better with acupuncture and the combination of both. Here, the integration of acupuncture in the West has been difficult, but not that bad. I mean, it looks like more and more opening, more and more breaking the skepticism on the authorities, and even acupuncture has been incorporated in public health hospitals in our country. So some proposals and conclusions: that we always treat our patients in a more integral way, either with this acupuncture or herbal medicine, and then we will always be offering a lot of benefits. No matter what, the patient always get a benefit. If it is strengthening the immune system, protecting from developing certain diseases, to fight against getting viral diseases like COVID, this is the case. Then, as I said, specifically in the mild cases, it will be very effective, but in any case, it will favor recovery in less time and will limit the progression to the severe stages. So, as I said, as a regular basis, acupuncture can also give this great effect, and I recommend highly the use of acupuncture, and of course the combination of both will be much better. Thank you very much. That is my talk for today.